Well, state Democrats say they have a plan to file bills as they try to change Tennessee's abortion ban, which officially takes effect next month. They say the state's trigger ban is dangerous and doesn't have enough exceptions. News Channel 5's Kyle Horan is following these latest developments for us very closely. And what's the focus in some of these laws or measures for Democrats, Kyle?
Yeah, Rory, there are actually a few ideas, but one of them, and a notable one, is they want to add an exception to the law for victims of rape, incest, or sex trafficking.
Pregnancy is never something that should be forced on a family, and it's never something that should be decided by the government.
In mid-August, Tennessee's trigger law, an outright ban on abortions, will begin.
Does this bill contain an exception for rape or incest?
There's no exception mentioned for rape or incest.
It follows the Supreme Court's decision to overturn Roe v. Wade. The new law only includes an exception for life of the mother.
Our state banning abortion could see up to hundreds of thousands of new births every year.
State Democratic lawmakers say that's not enough.
We need to make abortion a health care decision.
Democrats say they want to bring back reproductive rights. But with a Republican supermajority in the state, that's not likely.
This cause is fundamental to our rights.
They think they have a chance to add more exceptions to the current law, such as for rape, incest, or for victims of sex trafficking.
It's disgusting that a woman who's forced to have sex by crime would then be forced to become a mother by force of law. I don't think that's where Tennesseans are, and we shouldn't stand for it.
Other changes they want are for protections for the people who provide abortions. Right now, the new law would make it a felony. Even if it is to save a mother's life, they say the law isn't foolproof.
We're working on bills to not criminalize doctors. You know, this has an incredibly chilling effect on doctors. I was talking to a friend of mine just the other day. She's an ER doctor, and she's concerned about whether or not she's going to be able to help women immediately, right now, if she's concerned about, whether something is a criminal act or not. So there's a lot of confusion about all of this, too, because it's been rolled out so quickly.
Democrats admit these bills have little chance of passing, but they say these changes are worth fighting for. The legislature won't be back in session until January. I also reached out to state Republicans about this. Speaker of the House, Cameron Sexton, had this to say. He says, quote, "Every member in the House can file up to 15 bills. I'm sure members on both sides on the aisle will file legislation on this subject next year." Reporting live, Kyle Horan, News Channel 5.